Okay, we've been dispatched to a scene or a call of a 30-year-old female experiencing some sort of chest issues. We arrive on scene, my partner and I will make sure that we both have our appropriate PPE on. We've determined that the scene is safe, and so at that point we can go ahead and approach the patient. Hello, ma'am. How you doing? My name's Brian.
Hi, I'm Courtney.
Courtney, nice to meet you.
Yeah.
What seems to be going on today?
Just having some chest pain. Just,
Okay.
Yeah, not feeling right.
Okay, not feeling right.
Yeah.
Let's see what we can do for you. Right away, we can at least determine maybe not the mechanism of injury, but the nature of the illness is going to be her chest, some sort of pain. We'll get more to the bottom of that. We can determine that she's our only patient. No need for C-spine. We would at this time call additional ALS help. We would go ahead and put her on oxygen, 12 to 15 liters on a non-rebreather mask. There's no major bleeding that we can see. She's alert. Her airway is at least open because she's able to communicate and tell me her name. The pulse seems fine. The skin is, at that point, a little pale, diaphoretic. And we would determine that she's going to not be a need for rapid transport. So, ma'am, when did you say that this started? When did you start feeling this?
Maybe an hour or two ago.
Okay.
Couple hours.
Yeah, a couple hours.
I'm just kind of getting a little more pressure on my chest.
Okay. Is there any? I'm sorry.
It feels like a weight on my chest
Okay.
almost.
In your chest? Anything that you've been doing that can make it a little better, a little worse?
I mean, when I'm taking it easy, it feels better. Sitting down, but I mean, I was kind of working and having to walk around, stand,
Right.
and it just was making it worse.
Okay.
Yeah.
And you said pain-wise, or what it feels like. You said it feels like just pressure, or
Yeah, I mean, pain, isn't terrible, but definitely freaking me out, feeling pressure,
Okay.
feeling like a weight almost.
is it anywhere else in your body? Do you feel like on your arms, stomach, or just right in the chest?
No, I mean, kind of just a little numbness just thinking about it, but I mean,
Okay.
it's mainly just chest here.
Right. Yeah. Okay. If you had to rate, let's say the pain, you go 1, super mellow, not that bad. 10, worst pain you've ever felt.
I mean, pain, I would say maybe 7. I would
Okay.
say 7 or 8.
Okay. And when did you say again this started?
Maybe a couple hours ago.
Okay.
started out.
A couple hours now. Let's see. Any history of chest problems?
No history or anything like that.
Okay.
I mean, yeah.
You on any medication right now?
No, not
Medication.
currently.
How about allergies to anything?
I just calamine lotion.
Okay, calamine.
Yeah.
Okay, perfect. When was the last time you ate anything? this week?
I mean, I ate this morning, so a few
Okay.
hours ago.
Just a couple hours now.
Yeah.
Okay, that's not bad. Now tell me one more time what exactly was going on when you started feeling this.
I mean, it was just kind of running around, a little stressed out, things like that. Just, I mean, just the more active I was throughout the day, just kind of felt like it was more and more weight on my chest.
Okay.
And,
Okay. If you don't mind, I'd like to listen a couple of
Yeah.
your breathing
Yeah.
sounds. See how. Again, if you can just take a deep breath. Just come around here. Take a deep breath for me. We don't notice any blockage. We don't hear any stridor, no noises that I can hear. At this point, we'll go ahead and take some baseline vitals. So, okay, I'm going to have you, any preference in arms?
I don't
No?
know.
Okay, let's go ahead right here then, if you don't mind. Go ahead and get your blood pressure here. So we have a blood pressure. It's about 130/80. If you're okay, if you don't mind, I'm gonna go ahead and just breathe normal. I'm gonna try and take your pulse real quick for you. So we're looking at about 12 breaths a minute. pulse seems right about 70 strong, so I'm not exactly sure. We'd probably talk to ALS and try and get a bigger understanding or better understanding of what exactly is going on there, because as far as baseline vitals, they don't seem like anything that I'm terribly concerned about. At this point, once we had additional ALS or we were exchanging her somewhere else, we'd give them the story that we were dispatched to a 30-year-old female experiencing chest problems. Said she just felt like a lot of pressure on her chest, really painful when she was up moving around. Said she had a big day yesterday, whatever she was doing just kind of wore her out. Relaxing is making her feel better. She was allergic to calamine. She's eaten recently within the last couple hours. At this point, we would just transfer care to ALS and take it from there.